From IRS to IR mess when our next guest warned the president about the health care law to his face. The IRS scandal had yet to hit the administration in its face. The tax agency will be enforcing this health care law, and that's a big problem, Dr. Ben Carson. Doctor, good to have you back. At the very least, Doctor, I guess it's going to be delayed, even though the 16,000 agents are by and large hired. What do you think is going to happen now in the interim?
Well, unfortunately, we don't seem to be learning from our mistakes, and it's very clear that the government is too large. People don't know what's going on. The president doesn't know what's going on. None of his top people know what's going on. You're going to take all these people who don't know what's going on and put them in charge of the largest expansion of government in history. It's hard to imagine what's going to happen, but it's probably not going to be good. And maybe we should take that opportunity to say we're moving in the wrong direction. Can we all stop, all of us, Republicans, Democrats, Independents, and take stock of what we've learned here, and use our collective intellect to figure out a way out of this, rather than just continuing further down a path of destruction.
Yeah, Doctor, the more I look at it, there are more problems that keep coming up. It's running short on cash, dramatically so. Harry Reid saying that, Max Baucus saying that, two powerful Democrats have said that that wouldn't happen. Then we get these reports that Health and Human Services is hitting up private companies
and the
for
skinny plans.
Yeah, to keep it running. I mean, this thing is blowing leaks everywhere. Why can't they just admit it and say, well, we got to start over?
What's interesting is before we started all this, 250,000 Americans had health insurance. 80% of them were happy with them. I suspect a year from now, you ask that question, there's not going to be anywhere near that many people who have health insurance that they're happy with, and it's just getting worse. And there's still time to stop.
They're not willing to stop. If anything, much of what we've heard out of the Senate, as you know, Doctor, is, well, let's pour money in, we've got to promote it better, which is why Health and Human Services hit up companies, I think, like H&R Block and the Johnson Foundation to essentially promote the law, which does raise legal issues. But what do you think?
Yeah, it seems very illegal to me, because you've already got a government agency which has shown itself not to be impartial, and now you level subtle threats at companies that, unless you do this, who knows what could happen to you. We've already seen that happening. This is not fiction. This is reality.
You talk to more doctors, I'm sure, than I do, but I talk to a good many, Doctor, who tell me this. They don't like being doctors as much. And they, one in particular, who's a good friend of mine, urged his son to get out of the profession. He was training to be a neurosurgeon, to think long and hard about it, and that the environment might not be as conducive or even as promising. And his son did. Got out. So I'm wondering what you make of that and the mood among doctors who are not in a great mood.
Well, when I tell my colleagues that I'm retiring, and it really didn't have anything to do with Obamacare, everybody is so envious. How can you be retiring and getting out of this mess? But to some degree, I have to tell the doctors that we're responsible in a sense, because we haven't been more vocal, and we've allowed people to just push us around, and we're the people who really should be the advocates for patient care. So if we sit around and let a bunch of bureaucrats dictate how we should practice medicine, to some degree we bear some of the responsibility, but it's not too late for us to begin to exert more influence, because patients are the ones who are going to get the short end of the stick here.
Dr. Ben Carson, thank you very much. It's always good seeing you. It's become a very prominent figure in this whole healthcare debate. Some say maybe in other ways. We shall see. In the meantime,